the cuteness continues, with a prickly little patient brought in by the local hedgehog rescue.
Hey, guys. So, who do we have today?
Miss Dee Dee.
Miss Dee Dee.
Yes. We noticed yesterday that her snout is kind of swollen here on the sides, and then this one kind of puffed up a little bit. The night before, I picked her up and I was holding her, and I noticed that across the bridge of her nose was kind of swollen, so I wasn't sure if it was like a sinus infection starting.
How old is she?
5 years, 2 months.
Oh,
She's
you have
old.
all
Yeah.
older hedgehogs.
Yes.
Miss Dee Dee is a 5-year-old hedgehog, and hedgehogs do only live about 5 to 7 years, so Miss Dee Dee's definitely a senior citizen.
She's the oldest, and the old ones are the ones that I worry about the most because they have a harder time fighting everything.
Absolutely.
Yes.
Miss Dee Dee is just one of the dozens of hedgehogs cared for by the Hedgehogs of Texas.
We started a hedgehog rescue because there are so many out there that need the help. I started with 1, and then it went from 1 to 2, and then it went from 2 to 4, and now I have 30-something.
No, Miss Dee Dee, can I put this here? She doesn't want to bite me.
No,
She's a good girl.
Mm-hmm.
Miss Dee Dee's pretty laid back. She likes a little bit of attention, but not too much because, you know, she's an older lady, so she gets a little bit cranky like most hedgehogs do.
Oh, baby girl, you're being very good. Can you relax just a little bit more for me? I think everyone loves hedgehogs because they're really, really adorable. But there's a lot of things to consider about getting a hedgehog as a pet. First, they're nocturnal, so you really need a lifestyle where you're gonna be kind of up when they are. They also can get kind of grumpy, especially when they're at the vet. It'd be great if she let me look at her mouth. You think if you held her, I could take a Q-tip and pull her gums?
Yes. Ready?
Yeah.
Come on, let me have your nose. There we go.
Yeah, she has a lot of swelling of this gingiva.
Okay.
I can't say the tooth's just out down to right rotten, but it definitely warrants investigation.
Okay.
Taking a look at Dee Dee and just doing a really good physical, she definitely has dental disease. So I'm thinking tooth root abscess is at the very top of our list, and at very least needs to be ruled out. I'm sorry. Can I see your teeth, please?
There you go.
Thank you. So I would say she needs x-rays. Me trying to take x-rays of a hedgehog, it's probably not gonna be that helpful with my big x-ray machine. I really wanna use dental x-ray, so that way I can just take the little plate and take just the x-rays of the teeth I want. So I'm gonna take Dee Dee to see Holly, who's in dentistry, who's gonna be able to take our dental x-rays for us, one of the many benefits of being in this multi-specialty practice. We have these 2 bumps on its gums, here and here.
Oh, I see. Those teeth are tiny. They're the size smaller than like pencil lead. We are the only practice here that has a small enough sensor that can fit into that tiny mouth.
Give it just 20 seconds, 1. Okay.
Even though the digital sensor plate is small, it's as small as it's gonna get. They don't make them any smaller. So we had to push it back as far as the patient could tolerate it. Let's see what that looks like.
Okay. Ready? Mark, get set.
Go ahead and let him have his... Is that abscessy? Is that where it
looks
is?
abscessy to me. Taking a look at these x-rays, it's pretty obvious that she definitely has some blackness surrounding the tooth, which would be where an abscess is. So I really think the best thing to do is just to move forward and see if we can extract those teeth. I don't think that's gonna be easy, so we should make it really planned. Once we get back to treatment, I want to take a look at the teeth and make a plan, whether we'll actually schedule a surgery or just move forward with immediate extraction. Either way, I'm 100% confident that these teeth are the source of infection.